Osteosarcoma is an old and long-standing friend of mine. Maybe that's an ironic term. I think I started work on bone tumor cells 25 years ago. So that's a long time. Yeah, so osteosarcoma, bone cancers, is an area where we have, which has developed a long way in genetics. In fact, I think probably if I were to talk about a particular topic within osteosarcoma, I would talk about the first genome-wide association study, which was published by Sharon Savage and others in Nature Genetics in 2013. And for a rare cancer, they got together hundreds of cases and showed that there were two loci in the human genome, one of which involved a gene called GRM4, an enigmatic name. The glutamate pathways in cancer are an area of fascination. We don't really understand the biology, but they're definitely implicated in some way because there are so many mutations somatically and in the germline that are associated with glutamate-related glutamate signaling genes. These are thought to be important in neural function because they are involved in neurotransmitter function. Glutamate's a neurotransmitter, but what they're doing in cancer, we've got no idea. Anyway, this gene turned up, GRM4, and a colleague of mine, Dr. Maya Kansara, then began to do mouse studies to try and find out whether the gene itself in that locus was somehow implicated in osteosarcoma development. It turned out it was. And moreover, it seemed to be regulating a cytokine called interleukin-23. And she showed in a knockout model very elegantly that if you lose interleukin-23, you are protected. You are protected against osteosarcoma in the mouse. And that was a terribly important result because if you can knock out a gene in a mouse without causing an effect on the development, normal function of the mouse, it makes it a great potential drug target. Drugs knock out effectively gene function. So if you could, in the mouse, tolerate loss of interleukin-23 and it was protective, why not use a drug to target interleukin-23 in patients? It might be protective against retarded tumor development. And that's led to a clinical trial that we've been running over the past 2 years where we've been treating patients with an interleukin-23 antagonist. It was just fortuitous. Interleukin-23 antagonists have been widely used for a skin condition, psoriasis. So it was relatively well developed. We knew all about the drug. We knew how to use it in psoriasis. We were just simply able to ask the question, do we see any effects when we treat osteosarcoma patients? In fact, we also included other soft tissue sarcomas because the pathways appear to be important for them as well. And the data's not published yet, but it looks promising. And as a new immune pathway that might be relevant to sarcoma patients, I think that's a promising example of how germline genetics can be used to develop treatment options, not just early detection, but treatment options for patients.